lots of medications or intravenous injections or intramuscular injections that are given to patients often need to be reconstituted or diluted before use. So typically we'll use a small vial of sterile water or something of that nature to dilute them. And we talked about shortages already, but over the past decade, we've seen multiple waves of shortages of these types of small volume diluent type fluids. So lots of organizations I've worked for have reverted to really an unapproved and unsafe practice of hanging a large volume of like a sterile water bag or normal saline bag in a medication preparation room and having people pull off doses from that, which is an incredible contamination risk for patients. But in general, sterile water bags or sterile water bottles are often used for humidification or by respiratory therapy for other purposes. And anytime you have, like I mentioned earlier, two infusion products that look alike, like say a 0.9% sodium chloride bag right next to a sterile water bag, there are warnings on there, but they ultimately look very similar. So we want to be just cautious about where sterile water exists, because there's really no circumstance where that should ever be infused intravenously into a patient, because it can cause severe hemolysis reactions and can often be fatal for patients. So we just need to really be cautious about where these are and how they come in. In a lot of the examples we've seen, they've been procured by groups outside of pharmacy. So materials management groups in hospitals are often buying things. They're often the ones purchasing most of the large volume IV fluids. So they have access to buy bags of sterile water. So we really just want to make sure that they're not making their way and being stored in an unsafe manner on patient care units.